This is an Eyewitness News special presentation. Healthy for the holidays.
Coughing and sneezing, fever and sore throat.
What you're seeing here, is this happening all over?
Yes, everybody's basically seeing the same thing.
In this season of giving, it seems like we're sometimes giving and getting the symptoms of 3 highly contagious viruses.
COVID-19, influenza, and RSV, the so-called tripledemic, already making this one of the worst cold and flu seasons on record.
The hospital's full. We have no beds right now. We're surged with flu, we're surged with COVID.
And now with the holidays approaching and families traveling and gathering, there's real concern for our already strained healthcare system.
We cannot afford to have RSV, influenza, and COVID all hitting our hospital systems at the same time.
And good evening again, everyone. I'm Bill Ritter.
And I'm Sade Better-Noir. More people are getting sick, more hospitals are reaching capacity, and more families are having to make difficult choices about holiday gatherings.
No, this isn't 2020, and the days before the COVID vaccination. It's not 2021 either, and the pre-Christmas Omicron surge. No, this year we're in the midst of what is being called a triple-demic, as cases of COVID, the flu, and RSV are on the rise in our area and indeed across the country.
Over the next half hour, we are going to look at why these viruses are spreading so quickly and what symptoms to look out for. We're going to dig deeper into the nationwide medicine shortage and what parents should do if they find empty store shelves. And we'll speak to doctors about the best ways to protect you and your family over the holidays.
The truth is, we know we are all sick of being sick, so this is important information to keep you safe and healthy. We begin our coverage with Eyewitness News reporter Kemberly Richardson. She's live in Kips Bay. Kem?
Well, Bill, when it comes to staying healthy, doctors here at Bellevue suggest sticking to what they call the core 4: social distancing, wearing masks, washing your hands, and testing if you feel sick. With so many viruses making the rounds right now, they say acting fast and with accuracy is crucial.
Her cough kept getting worse. Struggling to breathe, Sarah's daughter was battling RSV.
Your kid needs oxygen going into their body, going to their brain.
Right now, it is one of several potentially life-threatening viruses rearing its ugly head.
We know that flu is circulating at unprecedented levels.
In late October, Sarah knew right away her youngest was heading down a very unsettling familiar path. The 4-year-old, who is immunocompromised, tested positive for RSV, a diagnosis she's received 3 times before.
They didn't want to have to put her on a higher level of support of oxygen, because or else she would need to be in an ICU. They wanted to see if they could stabilize her,
which doctors were able to do after just a few days. Experts say when it comes to RSV, we're still not out of the woods, but there are signs we are through the worst of it. The number of cases is declining while yet another virus is raging.
In my 25 years of practicing as a physician, I've never seen rates of flu the way they are this year. Not only is it early in the season, but literally the slope of the curve is straight up.
The numbers are staggering. Last week alone here in New York City, more than 18,000 cases of the flu, compared to roughly 1,300 during the same period in 2021. Since just October 1st, nationally, at least 8.7 million people have caught the same bug, of which 78,000 ended up in the hospital. Experts say the main reason there is an unbelievable amount of flu, we've been masking up for the past 2+ years. Our immune systems have not been exposed to respiratory pathogens, and so we're getting sick. COVID-19.
In particular, we're seeing the BQ lineage as well as the XBB lines. I know, it is alphabet soup.
When it comes to COVID in the 5 boroughs, last week there were roughly 3,500 cases. That same week in 2021, close to 9,000. But remember, officials do expect a spike after the holidays. Looking ahead, Dr. Wallach and others believe this is our new normal, and so the most important thing to do if you're not feeling well, they say get tested right away.
The reason why that is so important is to understand what your infection is, because if you have COVID, if you have flu, we have readily available treatments that will make your course much better. However, you need to start those treatments early.
And right now, New York City is offering free COVID, RSV, and flu tests. And on a larger scale, shipments go out today nationwide for free at-home COVID tests.